I'm Suzanne Green. I'm the practice administrator for Palm Beach Diabetes and Endocrine. We've been in business for 30 years. We're a very busy practice. We have 10 providers and 2 nurse practitioners in 4 sites. So we do Jupiter, Flagler, Wellington, and Boynton Beach. So we have a very dynamic range of patients and referring physicians. I would have to say Wellbox has really helped our practice with continuity of care, patients' convenience, keeping our patients on track for their next visit, helping reconcile their medications, and really being a resource for our patients. Although we didn't get into it for the revenue component, we really got into it for patient care, but we are starting to see a return, and that is a good thing for the practice. Macro and MIPS is a challenge for any practice in this day and age, so it's really helping us hit the spots that we need to. Physicians sometimes forget to check off a box, and when we have other individuals going into the patient record, they're asking questions, and it really helps us hit our target goals. I would have to say patient compliance has really gone up about 60%, because when patients come in, they're told to bring their medications in a bag. When they're done their visit, we ask them if they understand their medications, and for us, having someone from Wellbox reach out to them really helps us with the reconciliation and the daily medication. Wellbox has helped our patients in so many ways that we didn't even anticipate when we signed up with Wellbox. It's really about a partnership, so now patients understand that Wellbox and Palm Beach Diabetes act as one. So it's a resource for our patients. It's helping them with outreach, whether it be to another physician or to a place to go look for diabetic shoes, and also as another way for the patients if they need to contact us. So whether it be about a message or, by the way, I was in the hospital over the weekend. So it really helps us with follow-up. Our patients absolutely love it. Patients didn't have a concept of what chronic care management was about. So you say CCM to someone and the patient's, I don't know what that is, please explain it to me. So for us, chronic care management, because it is a reimbursable code with Medicare now, patients are getting the grasp of what it's about and wanting to be part of it. The one thing that I hear all the time, the patients say, oh, this is a great resource for me, because sometimes during the week I have questions and I don't want to bother the office. So by that time I'm thinking about it, and someone from Wellbox has either called me or sent an email or reached out to me and wanted to just have a discussion about how my last visit was. Am I hitting my target goals? Are my sugars where they need to be? So it's a learning curve. We've only been with it since April of last year. Patients are just now getting into the groove of it, and they're telling their friends and other patients. So we're getting calls now of people that haven't been seen yet but want to sign up for it. This really has extended our practice in a sense that we have nursing staff. We have 2 nurses that work with every physician, but now what we have is a partnership in Wellbox, reaching out to our patients, checking on them in between, making sure they're hitting all their goals, and helping them stay where they need to be with their A1Cs and their thyroid medications and everything that has to do with about their health care in general.